AMLS 2026 Advanced Medical Life Support Certification Exam Tips. All you need to know. Question 1. A 45-year-old with pinpoint pupils and shallow respirations should receive naloxone first, suction and oxygen first, blood glucose check, immediate intubation. Suction and oxygen address immediate airway/breathing before medication. Question 2. What condition is likely in a COPD patient with acute shortness of breath, angina, pulmonary embolism, hypertensive crisis, heartburn? COPD patients are at high risk for PE, which can cause sudden respiratory distress. Question 3. The renin-angiotensin-aldosterone system, RAAS, causes vasodilation, increased preload and afterload, bradycardia, sodium excretion. RAAS is activated during shock to increase pressure and volume. Question 4. Clear breath sounds with tachypnea are classic for pneumonia, pulmonary embolus, asthma, heart failure. A lack of lung sounds, clear, but high respiratory rate often suggests a vascular issue like PE. Question 5. Which condition is most likely to cause respiratory acidosis? Anxiety, narcotic overdose, methanol ingestion, salicylate OD. Hypoventilation from narcotics leads to CO2 retention and acidosis. Question 6. Aching chest pain relieved by leaning forward suggests ME, pericarditis, PE, aortic dissection. Positional pain, worsened supine, relieved forward, is characteristic of pericarditis. Question 7. What is a hallmark of compensatory shock? Hypotension, narrow pulse pressure, bradycardia, decreased mentation. The body maintains BP by narrowing pulse pressure through vasoconstriction. Question 8. Initial treatment for a patient with methanol ingestion involves charcoal, fompazole or ethanol, naloxone, albuterol. Fompazole blocks the conversion of methanol to toxic metabolites. Question 9. What is pulsus alternans? Difference in BP between arms, alternating strong and weak pulses, a drop in BP during inspiration, irregular rhythm. It is often a sign of severe left ventricular failure. Question 10. What is the most common cause of cardiogenic shock? Sepsis, myocardial infarction, dehydration, tension pneumothorax. ME is the leading cause of pump failure leading to shock. Question 11. A patient with a tearing pain radiating to the back may have ME, aortic dissection, pneumothorax, GERD. Tearing pain to the back is a classic symptom of dissection. Question 12. Cushing's triad includes hypertension, bradycardia, and tachypnea, irregular respirations, fever, hypotension. It indicates increased intracranial pressure. Question 13. In hyperkalemia, what is a common EKG finding? ST elevation, peaked T waves, U waves, prolonged PR only. High potassium causes tall, tented T waves. Question 14. What is the goal of the AMLS Assessment Pathway? To diagnose everyone with ME, to identify and treat life threats systematically, to bypass the hospital, to replace a doctor. The pathway provides a systematic approach to medical emergencies. Question 15. Which type of shock is caused by a massive allergic reaction? Septic, anaphylactic, neurogenic, hypovolemic. Anaphylactic shock is a form of distributive shock. Question 16. A patient in DKA will typically have what respiratory pattern? Biot's, Kussmaul, Cheyne-Stokes, apneustic. Deep, rapid Kussmaul respirations are the body's attempt to blow off CO2. Question 17. What does the S in APRST stand for? Safety, severity, stability, suddenness. Severity helps quantify the patient's pain level. Question 18. True or false, distributive shock always presents with cold, clammy skin. True, false. False. Early septic or anaphylactic shock may present with warm, flushed skin due to vasodilation. Question 19. What is the definitive treatment for a tension pneumothorax? Intubation, needle decompression, for fluids only, beta blockers. Needle decompression relieves the pressure that impairs cardiac output. Question 20. A patient with RUQ pain and jaundice likely has issues with which organ? Spleen, liver/gallbladder, appendix, bladder. Right upper quadrant pain and yellowing are classic for hepatic/biliary issues.